Hello, everybody. So I think attendees are just coming into the meeting. I will therefore give a slow introduction just to enable everybody to join us on the call. So a very warm welcome to this session in which we're discussing this very important report, A Future Well and Fair, a post-COVID vision of the welfare state. And today's seminar is hosted by the Mile End Institute at Queen Mary University of London. My name is Patrick Diamond and I'm the director of the Mile End Institute, and we're very pleased today to be associated with the launch of this report and the very important research that Paul and Mary are going to be discussing in the course of the session this afternoon. Paul and Mary are going to talk about the findings of their report. They're going to outline some of the current problems that affect the UK welfare state, and they're also very importantly going to discuss their future post-COVID reform vision. For those of you who don't know Paul is a reader in public policy at Queen Mary. His research focus is the political economy of European integration, particularly in the context of the welfare state, and he's written and produced a number of publications and books on these themes. Mary Daly is Professor of Sociology and Social Policy at the Department of Social Policy and Intervention at the University of Oxford, and her research interests focus on the analysis of social policy in OECD countries with a particular interest in family, gender, care and poverty. And in July 2017, she was elected as a Fellow of the British Academy. To help us think about the issues that are raised in this report today, I'm delighted to say that we're joined by an expert panel who have also contributed, I think, to some of the ideas that are discussed in this report. I'll introduce each of our panelists in turn, and then after Mary and Paul have spoken, each of the panelists will respond for around 5 minutes before we get into the discussion. If you would like to put a question to the panel, then please use the chat box or the Q&A function. We'll be monitoring these throughout the event. And I should say that if you've got a question or a comment or you want to make a point, please do so. Obviously, the success of these events in part relies on interaction with and questions and comments from the audience. In terms of our respondents, let me just introduce them briefly. Our first speaker will be Professor Sir Michael Marmot. Michael will be well known to many people in the webinar. He is a professor at University College London and director of the UCL Institute of Health Equity. And of course, Michael has worked extensively on issues concerning health inequalities for over 40 years. At the request of the British government, he conducted a strategic review of health inequalities in England, which was published in February 2010, Fair Society, Healthy Lives, and has recently launched the Marmot Review 10 Years On, which seeks to update the analysis in the original report. Our second speaker will be Councillor Rachel Blake. Rachel is a Deputy Mayor and Cabinet Member for Adults, Health and Wellbeing in the London Borough of Tower Hamlets, and she was first elected as a councillor in 2014. Our third speaker will be Chris Goulden. Chris leads the Impact and Evidence team at the Youth Futures Foundation, and he was previously Deputy Director of Evidence and Impact at the Joseph Rowntree Foundation. Our final speaker among the respondents will be Henry Parkes. Henry is an economist at the Centre for Economic Justice at the Institute for Public Policy Research, and his work has covered a range of topics including labour markets, welfare, taxation, and industrial strategy. And prior to joining IPPR in 2019, Henry was an economic advisor in the Government Economic Service. Okay, so that's enough introductions from me. What I'm going to do now is pass over to Paul and Mary, who are going to give us a presentation outlining the findings in their report. So Paul, over to you.
Thanks so much, Patrick. Let me just share my screen with you. We'll just take a moment to load up. Brilliant. So thanks for that introduction. I'm just going to introduce the report before I pass over to Mary. Thanks for everybody who's come along and also who contributed to the project and the discussants on the panel today. as well. So let's just build on, let's just sort of gain some context in terms of this report and where we are coming from. Prior to the COVID-19 pandemic, the cracks within the UK welfare state were already apparent. Over the last decade, many of the social indicators have gone in the wrong direction. Poverty, and in particular child poverty, has increased where in 2018, 2019, 30% of UK children were living in poverty. In addition, the majority of families who experience poverty are in working households. To this, we can add the growing number of individuals in poorly paid jobs with few prospects to move into higher paid work, and the fact that by 2020, there were over 1 million individuals on 0 hours contracts without a weekly guaranteed income. Individuals in poorly paid jobs are more likely to experience long-term health conditions and mental ill health. The care system, and in particular that of adult social care, is buckling to care for an aging population and is inadequately resourced. And the pandemic has put the capacity of the welfare state under the spotlight, with evidence suggesting that the impact of the crisis is almost certain to worsen the social and economic fabric of the UK. In many respects, the social and economic fabric of the UK is regressing. This needs to be addressed as a matter of urgency, and importantly, it can be addressed. We believe that the pandemic presents us with a major opportunity for change, and that major opportunity is now. A problem we're faced, however, is that all too often proposed solutions emanating from research fail to gain much traction beyond the immediate circles of research and think tank communities. We know more now, we have more knowledge at our fingertips than we've ever had, yet in many respects it doesn't gain the traction that it deserves. When it falls, it often falls flat and doesn't get the longevity that we would like. And that was the frustration, I think, that both Mary, I, and Alistair, our other co-author of the report, felt, and that's why we came to this project. That was what was sort of really driving our aim. So our aim then is to identify what are the policy weaknesses in the welfare state and to draw up a realistic future vision that can gain traction and credibility. The report is about initiating that conversation, initiating that process, and thinking about how we can move forward, beyond the current structures of the welfare state. In doing so, our report and our project thereby adopted a particular approach. We ran 4 roundtables with experts conducted in February 2021, and those experts were drawn from research and policy communities. That's important because each of those contributors, 33 in total, are at the forefront of the research in this field, all of which is evidence-based. These roundtables concerned active labour markets, anti-poverty, adult social care, long-term conditions, and mental ill health. Those roundtables were 2 hours long, and we focused on a particular format in each of those: the strengths and weaknesses of the policy area, the impact of COVID on the field, and the most urgent areas of reform and the feasibility of those solutions. The interrogation of those 4 policy areas, as is done in the report, is important in its own right, but the reform vision needs to be greater than the sum of its parts. And this is what the report offers, a cross-sectoral, holistic vision of reform that we think is achievable and realistic. We'll come back to that towards the end, but for the moment, I'll pass over to Mary, who will be going through each of the policy areas for us. Thank you.
Good afternoon, everybody. Thank you so much for joining us. And we hope that this will be a good conversation because, as Paul said, that's really our main aim, to start and continue a conversation about the welfare state in the UK in the context of COVID, and we'd like to acknowledge, I think at the outset, that there were some good policy responses in relation to COVID. And in fact, our report, once you read it, you will see that we explicitly asked about what was good about policy, or what improvements were made during COVID. In my slides, which I will cover now, the 4 areas we talked about or we investigated specifically, my slides, as you can see for the first one, are organized around what were identified by the experts as the key problems, and there's just a summary of them on each slide, and then also some suggested solutions. I would encourage you to read the report, which actually isn't very long, for more detail. So the first field we looked at was so-called active labour market policy, and this is a relatively new term in some ways in social policies circles, and it refers to ideally it refers to 2 types of intervention. One is an intervention with people who are outside or have problems getting access to the labour market, those who are unemployed, for example, or underemployed. And the ideal of the kind of welfare response to those is that they would be provided with adequate supports in job search, that they would be provided with training, for example, or upskilling, and that they would also be provided with subsidized support to enter and remain in the job market. That's one type of intervention. And the second is that there would be intervention in the labour market itself to ensure conditions of work are adequate, for example, and particularly to ensure that pay rates are enable people to have an adequate income. That's the ideal, but in this country, the implementation of active labour market policy, particularly for the last 10 or so years, has been less than the ideal, with the result that certain problems have emerged. So we've had quite a bit of reform. The universal credit system itself is a major reform, one of them, the biggest reforms ever undertaken in this country, but actually one of the biggest reforms ever undertaken in most countries. And you will see on the slide that there are 3 or 4 problems that we've identified, or that the experts have identified really. The first is that the model in the UK, the economic model, the reliance on economic growth in the UK is relying on low paid and flexible jobs, primarily in the service sector. So this big labour market vision and the vision of enabling people to enter the labour market and be self-supporting in the labour market, and that's another underpinning principle. That's relying on particular sectors of the labour market, which don't appear able to deliver because there hasn't been much labour market reform. We also have a system which, for those in the labour market, as well as for those outside of it, that there's too little training and too little upskilling and reskilling. And in our reform of the welfare system, we've instituted a system which has a high benefit conditionality. Many people have to pass many tests and also have to meet many conditions before they're given income support. And we now know from the evidence that we have available on universal credit in particular, that it is really failing to significantly enhance the likelihood of people moving into work. So its very purpose, or one of its very purposes, is not being met. And some of the suggested solutions, for example, was to take the first there is to take a joined up approach, that benefit levels themselves need to be improved, pay rates need to be improved, but they need to be approved or improved in tandem with each other, because that's that's the kind of functional logic of the new benefit system that we have, that there is this inalienable relationship between welfare and work. Secondly, the recommendation or a recommendation is around training and upskilling and reskilling, for example. And the experts suggested that as well as training and upskilling for those who are outside the labour market or on the margins of the labour market, we need a national policy on vocational training as standard. And then the third recommendation that we picked out to highlight at this presentation is that we need an industrial strategy, and that industrial strategy should have the state playing a key role in creating and supporting high-skilled jobs, rather than at the moment where we have a reliance on the market sector to produce jobs. The state needs to be more active, much more active. The second area we looked at is anti-poverty policy, and Paul has already given some of the context here. We know from the latest statistics, predating COVID, particularly, that up to a fifth of the population, even more than a fifth of the population, falls below the poverty line, and that significant numbers, 30%, I think, is around the estimate of children who also fall below the poverty line. But one thing that the experts mentioned particularly to us was not the amount, was not just the numbers of people in poverty, but the depth of some people's poverty. And statistics suggest, for example, that there's at least 1.5 million people in this country who are destitute, who have no resources at all. And somehow around 4 million people who fall halfway again below the poverty line. So that it's not just the amount of people who are poor, but the actual growing gap for those who are below the poverty line, which means a much growing gap for the population as a whole. So when we asked the experts to talk about, to hone in on the system, and universal credit, I suppose, is our main system now for relying on as an anti-poverty measure, even though we rely on the jobs market as well. What came across very much is the relatively narrowness of the approach that's taken to addressing poverty in this country. It seemed to be primarily a problem for universal credit, as I said. This means that the causes of poverty aren't really addressed that well, particularly the structural causes, and we may see those in the education system, we may see those in the health system, we may see those in the income and taxation system, we may see those in the housing system particularly. And so those things aren't being addressed, and other factors like inequality and so forth, and intersecting inequalities. Benefit levels are very low. They were increased a little bit during COVID-19, and the debate about that is whether we should keep the 20% or the £20 uplift a week that was given to people. We think that's a narrow debate. That's too binary a debate, and there should be a much bigger debate around adequacy and benefit levels prior to COVID, during COVID, and post-COVID. And we have a situation where we have benefit caps, and they push people further and further below the poverty line, as I said, which means poverty gap is getting bigger. And there are aspects in the system that the experts identified that actually cause poverty or cause hardship, like, for example, the 5-week waiting list, the fact that people have to pay back everything they borrowed, for example, and also other administrative aspects. So the suggested solutions is an effective anti-poverty system that would target both the numbers of people below the poverty line and also the depth of their poverty, especially by getting rid of many of the existing caps in universal credit. We also suggested, the experts also suggest, and we agree with their suggestion, that an anti-poverty policy should not be limited to particular sectors, but actually should be treated as a whole of government matter. That happens in other countries, for example. And we were very concerned, and the experts were very concerned about the treatment of people, the extent to which people are treated with respect and dignity within the existing system. And that seems also like something that must change. Our third area was on social care. Paul, could you put forward the slide, please? And we heard a lot about social care during the pandemic. And there were also, I think it's important to say, some good things that happened in social care during the pandemic. For example, the dedication of many care workers, formal and informal support workers, the dedication of many providers of care to the people they care for, institutions such as care homes, for example. The media, I think, has played a very important role in actually outlining the problems in social care, and families and communities have been mobilized as well. But, you know, I suppose above all, what the pandemic did was reveal the existing weaknesses in our social care system and the seeming inability of the political system to actually reform it. So health and social care, as we know, operate as two separate systems, and there is a lot of debate about joining them up. I mean, for me personally, I don't know if the problem is in whether they're joined or not. I see the problem particularly in the underfunding and the under-prioritizing of one vis-a-vis the other. So health system has been hugely prioritized during COVID-19 and prior to it, and the social care system has been really deprioritized. There is a heavy dependence in the social care system on market providers. And this actually, ironically, because we have this ideology that the market is the better provider than the state, but actually in this instance, it isn't necessarily, and it doesn't necessarily offer better value for money or even better choice for people who actually have the money to pay for it. So social care came across very much in our discussions as a site and source of unfairness and inadequacy. And among the suggested funding is, yes, there needs to be more funding, and we need to find better ways of funding the system. And some suggestions are there on the slide, for example, like a once-off wealth tax, as has happened in the past, or an extra 1p in the pound income tax. And there are also some other suggestions in the report. The CARE Act 2014 was actually in many ways a good act, but it's not really been implemented. And certainly in the last years, it's been put to the side. And we think there are important preventive aspects in that need to be renewed. The conditions of paid and unpaid workers need particular attention. There hasn't been much attention given to those as we respond to COVID, or indeed prior to COVID. And then, you know, we have to really consider the sustainability of the existing system that we have, and whether the heavy reliance, 85% of the providers of care homes in England, for example, are private sector providers. Many of these are in it for profit, and there is considerable profit taking out of the system. We have to consider, is that sustainable? My last slide is on long-term conditions and mental well-being. And we're talking particularly here about chronic illnesses, both physical illness and also mental illness. And there was quite a lot of discussion in the sessions with problems. So unemployment, we have to ask, I suppose, what is health promoting? And unemployment, we know, disproportionately impacts lower socioeconomic groups, and thereby the health and mental health of such individuals. And Michael Marmot has done huge work under the term of health gradients, really, and I'm sure he will talk about that. So it is those who are already disadvantaged who have the worst health, and equally the system of disadvantage that's actually creating ill health in many respects. The health system itself has a particular model, and it's mainly modeled on acute episodes, and it is less able to deal with so-called multimorbidity, which refers to kind of long-term multiple ill health on both physical and mental. And there is limited support for those with long-term conditions who are in the labour market, even though the thrust of policy in the last years has been to get people as much as possible in the labour market. People working with long-term conditions need better support. And some suggestions is the Equality Act. We have a good Equality Act from the Equality Act 2010. We think that needs to be resurrected and work more actively on. And we should also extend a rights-based approach to those living with long-term mental and physical conditions. The link between social conditions and health, or ill health, or lacking full health, should be at the heart of all policies. And particularly increased resources are needed for mental well-being services.
Thanks so much, Mary. And thanks for that sort of great overview of some of the findings of our report. Just coming on then to think about the future, I would think it's worth just emphasizing some of the broad themes that came out of our research in this report. And that really is that in its present form, the UK welfare state not only risks failing to protect and support individuals it intends to help, but it's also contributing to problems, and in some instances is actually creating them. Critics argue that the UK welfare state is based on two broad assumptions. First, that the most effective efficient and responsible form of decision making is that which is deferred to the market. And secondly, individuals reliant on welfare are undeserving, broadly determine their own life chances and can improve their situation by working hard. Some also perceive the UK model to be caught in a downward spiral of low pay, insecure employment, rising poverty, increasing long-term illness, inadequate adult social care, poverty level benefits, and limited social security entitlement. As Mary was saying, some of the changes introduced as a result of COVID are positive, but when you survey the whole landscape, it reads for quite depressing news. In proposing a future vision, it's tempting to focus on each of these 4 policy areas, construct a reform agenda for each and suggest where improvements could be made. But this, we believe, would continue the siloed treatment of welfare policy making. It would represent a form of muddling through and would more or less continue the current practice of reactionary short-term reform. Tinkering at the edges will simply lead to more of the same, and it will not enable the UK to move beyond this current trap with which it is in. Not only, of course, will COVID-19 have a significant impact on health and health-related resources, but the current welfare model is unlikely to provide sufficient support for the greater number of individuals who may need it. And if the UK is to become prosperous, healthy, fair, and more equitable, we need to acknowledge that the current system of welfare is effectively broken. Reform needs to be both visionary and realistic, but it also needs to be addressed in the real world of politics. And that is a challenge in many respects. One of the things that came out of our roundtables was the limited platform that champions of this area actually get in the real world of politics. And so what we are proposing then are 5 sets, 5 principles to guide this future reform agenda, to think about joining up these problems, to think about how we can move forward, and importantly, take the electorate with you whilst you do that. And those 5 principles are outlined in front of you on the slide, and they're also explained in the report. And let's just go through those for the moment to just sort of flesh out what we're thinking about here. We need to reposition the reform lens, okay? That's the first sort of major point we would make, to focus less on individual policy areas and more on key themes that cut across numerous policy areas. And a life course perspective is a classic way of recognizing the interconnectedness of people's support needs, that people need support during different times of their life. They will require different types of support rather than simply coming in and using the welfare state or being reliant on the welfare state in a very simple transactional sense. Reforming then needs to be done so in target areas. To create what we would call ripple effects throughout the welfare state. And there's some really interesting examples here of some things you could do that would make a huge difference across several different problems in the welfare state. Ending low pay and poor quality jobs would be a huge benefit to everybody and all of the areas that we looked at. It would prevent churning between the benefit system and employment. It would reduce poverty, increase the possibilities of individuals moving from low paid to higher paid work, improve stability and potential quality in the adult care system, reduce the number of individuals experiencing long-term conditions and mental ill health. A second one, if you improved education and training for individuals in and out of work, that would enable individuals to move from low paid to higher paid jobs, thus potentially reducing poverty, thus potentially reducing ill health and mental ill health as well. And if you increase social housing and the provision of affordable rents, you'd also reduce poverty and cut the number of individuals experiencing long-term conditions and mental ill health problems. So thinking about these targeted areas that can tackle several different problems could make a substantial difference to the welfare state. Our third sort of principle is actually reimagining the case that government can raise taxation and should raise taxation. Some of the proposed reforms require more government spending, and that is an issue and is also, I think, quite obvious. And this will result in higher levels of taxation, but you could create a broad consensus for that. You could close the gaps within the existing tax system. And if you reintroduced elements of universalism into the welfare state, you could sort of reimagine that whole relationship between taxation and the welfare state and how people perceive it. One of the most fascinating findings, I think, from the report for me has been that, you know, as UK taxpayers all pay into the UK welfare state, but your chances of being able to access it are actually quite limited. Having said that, not all reform requires spending. Regulating can be a super effective way of creating policy change. And one of the most successful regulatory policies in the area of welfare over the last 3 decades has, of course, been the national minimum wage. And there's no reason why that couldn't and shouldn't be extended to a national living wage, which could make some substantial differences along a number of the areas that we looked at. Housing is also an area that really contributes to poverty. You know, the scale of or the proportion of your income you spend on housing is ever increasing, and there's no reason why that couldn't be tackled from a regulatory perspective. And finally, a plea to think about this differently is to revitalise political leadership to ensure that they make informed decisions based on the evidence presented by contributors to our report. Often there's a reliance, as we've said, on market-based decisions or party doctrine. And in reality, what we need is more evidence-based policy around these issues, and maybe a broad consensus across different political parties to make change and do something here would be a really fantastic way forward. So in short, what we're calling for is to think differently about this particular issue, about thinking differently about reforming the welfare state. And it's only by doing that that we can move beyond the current trap that we are in and really create a country that is actually fair for all. So thank you.
Okay, well, thanks so much to Mary and Paul for a really fascinating introduction to their report. As Mary said, the report is actually a fairly succinct report that can be read relatively quickly. So I do recommend, for those of you who are interested, please do make sure you get a copy of the report. It's really worth reading in full to get a sense of all of the different arguments and points that Mary and Paul and Alistair are making. I think also that a core theme of the report really connects with a lot of the work that we've been doing at the Mile End Institute over recent months, which is really about this crucial question of, does COVID and the aftermath of the pandemic provide a kind of critical juncture in public policy that will lead to more transformative change in terms of direction of how our economy and society is managed? And I think obviously the jury is very much out on that, but Mary and Paul give us a lot of food for thought around that question, which we perhaps ought to consider more in the second half of the seminar. But that's enough from me. I want to give our panelists a chance to respond. I'm going to come first to Michael Marmot. Obviously, there's a lot in this report that touches on issues of health and health inequalities. But Michael, it would be really great to get a sense from you about your ideas and what your thoughts are in response to the findings of this report. So over to you.
Thank you. Well, to start with what you put forward as a proposition about COVID, I agree with completely. As you said in the introduction, I did my 10 years on report in February 2020. I waited 10 years to see what had happened to my 2010 report. But I did the next one after only 10 months. In December 2020, we produced Build Back Fairer, the COVID-19 Marmot Review. I said at the beginning of the pandemic, it will expose the underlying inequalities in society and amplify them. The pandemic is not really about a virus, it's about society. And we can see that. Our catastrophic response to the pandemic shows us something really very important about society. We could have been like Germany, and we weren't. We were like the UK to type. And the pandemic and everything that went along with it exaggerated the inequalities. I'll come back in 5 minutes, so it won't take me long to come back to what I want to come back to the response. So let's look at the 4 areas that you've chosen, and I'm delighted with them. 2 of them were in my 6. The work and poverty are both, my 6 were give every child the best start in life, education and lifelong learning. Let's look at education. The opportunity that emerging from the pandemic gives us to build back fairer. The Prime Minister is a classical scholar. He knows what decimate means. His external advisor recommended £15 billion to spend on reducing the educational divide coming out of the pandemic. And he chose to spend 1.5 billion. He decimated it. So money does matter if you're serious about leveling up. The third of mine was employment and working conditions. And I'm delighted with the approach that you've taken. It really fleshes it out. And active labour market policies, the quality of work really matters, as well as having work. The fourth of mine was having enough money to lead a healthy life. And the point that Mary made, that it's not just how many people are below the poverty line, but how far they are below the poverty line. A few years ago, I read the book by Eden and Schaefer, $2 a day in the US. So the global poverty level is $1.90 a day. And this was about the 1.5 million people in the US who are essentially leading cash-free lives. They have no money. And Mary talked about the vast numbers in Britain. And when you think about the kind of recommendations we make to people, eat healthily. Well, if you're living without money in the US or the UK on $2 a day, what does eat healthily mean? Eat would be quite nice, never mind eat healthily. Calories would be quite nice. And some well-meaning person like Michael Marmot comes along and says, read bedtime stories to your children. And the response might well be, I would, if I knew I had a bed, let alone a book. So a lot of the recommendations that we make about early child development, for example, in situations of absolute, never mind relative poverty, these are impossible. The fifth of mine was healthy and sustainable communities in which to live and work. And you touched on housing as a cause of poverty. I mean, the housing crisis is severe, but also looking at communities and what can happen at community level. And as we were chatting before the start, we're publishing a report next Wednesday on our work with Greater Manchester. And a lot of that is what can happen at community level. And our sixth, which kind of relates to your fourth one, was taking a social determinants approach to prevention. And so that dealing with long-term conditions shouldn't only be about treating them, but also preventing them. You can wait till people get diabetes and deal with their vascular complications and their renal complications and their ocular complications, or you can try and prevent obesity. And obesity follows the social gradient. I liked your comment, but it was almost a throwaway comment about the opportunity to go back to universalist policies. You'll know that in my 2010 report, we coined the phrase proportionate universalism. We were trying to bring together traditional approaches to targeting and a more Nordic approach to universalist policies. I note that a leader in The Guardian this morning picked up, I don't think he used the word proportionate universalism, but he picked up from my report the fact that this goes across the gradient and targeting the worst off. So while I'm entirely sympathetic with what you said about anti-poverty strategies, we also need to think about the whole gradient, not just people at the bottom. And in a way, so I said I'd come back. Let me finish. That I asked myself, and I was thinking about how we're going to implement your incredibly sensible recommendations. And I asked myself, why did we have such a poor state of health come before the pandemic, which was the thrust of my 10 years on report? Life expectancy had more or less stopped improving, inequalities were getting bigger, and health for the poorest people was getting worse. That's where we were pre-pandemic. And then we had the highest excess mortality in the first wave of the pandemic of any rich country. And what was the link between having such a poor state of health coming into the pandemic and doing so badly during the pandemic? And I suggested that could work at 4 levels. The quality of governance and political culture, and that's crucial to implementing your recommendations. Second, the increasing social and economic inequalities. Thirdly, the disinvestment from public services, and you've highlighted the lack of investment in local government. And fourthly, the fact that we weren't very healthy coming into the pandemic. So it seems to me to implement your proposed changes to the welfare state, which I entirely applaud, we need to deal with those 4, with the quality of governance and political culture. Because you could do what you're suggesting if we had a decent government and political culture. And forgive me, I'm just so upset, which is what the Guardian leader was about today, at this report about poor white kids not doing well in school. Poor white kids do not do well in school. That's right. Look at deprivation, look at poverty, look at deindustrialization, look at all the things that in your report, ample explanation for why poor white kids don't do well in school. And what did this report say? Somebody mentioned white supremacy, and that's giving favor to non-white kids, and that's why poor white kids don't do well in school. What a hopeless, useless contribution to an important public debate that is. The initial fact is correct. Poor white kids do worse than Bangladeshi and Pakistani kids in school. That should exercise us. We could also ask, why do poor Bangladeshi kids do better than poor white kids? What are they doing right, as well as what are white kids doing wrong? But let's have a sensible public debate. That's what I mean by political culture. To turn it into a culture war seems to me monumentally unuseful. So we've got to address governance and political culture. We've got to address the magnitude of social and economic inequalities, the disinvestment from public services, and deal with the fact that we weren't very healthy. We're doing badly compared with other rich countries. And I think your report is an important contribution to that. Thank you.
Well, thanks so much, Michael. A lot of very powerful points there that no doubt we will want to go back to and discuss in the contributions afterwards. I'm going to come on now to ask Rachel Blake to give her response. Rachel, obviously through her work in Tower Hamlets, will have seen the very direct effect of both the pandemic, but also the wider changes in the shape of the welfare state and the impact that that's had on people who live and work in the area where she has been leading the work of Tower Hamlets around issues concerning employment and well-being and so on. So Rachel, really looking forward to your thoughts and ideas on these questions. So over to you.
Thanks, Patrick, and thank you to the authors of the report. And it's always deeply inspiring and thought-provoking listening to Sir Michael Marmot. So thank you for the invitation to take part. I wanted to structure my remarks around a general comment about the huge challenge of addressing the wider determinants of health, because I just don't think you can have this conversation by underestimating how big a challenge it is in terms of what the solutions really are. And we need to wake up to the scale of that challenge. And I want to put that in some context with the challenge of creating the welfare state, which was a different challenge. And you can't respond to two different things with the same thing. So that's one of the first areas I want to talk about. The next is about connection versus isolation, and what we have found in Tower Hamlets as a community and as a council about some of those contrasts and what we do to address that contrast. The next thing is about trust and political culture, which obviously the report talks a bit about in terms of revitalisation, and Sir Michael Marmot reflected on as well. The third is about the join up of health and social care and how we put real energy and meaning behind that. And the last area to talk about is implementation and delivery, and some of the things that I think can and should happen in order to address this. So in terms of the wider determinants of health, Sir Michael Marmot reflected on you can't eat healthy if you can't afford to eat healthy, and you can't do the extra reading and time if you don't know where you're going to be from day to day and week to week. And I was reflecting with friends just earlier today about how we keep saying eat healthy, 5 a day, stay active, without really thinking about why aren't people eating healthy and staying active. And I think until we start challenging ourselves with the moment there seems that we are too reliant on broadcast messages of 5 a day, stay active and stay away from air pollution, without really working with people to talk about what the barriers to that might be, whether or not it's access, which it is in some areas. Access to healthy food is a really big issue in some areas, and it's not in others. So in Tower Hamlets, we're lucky with our high streets and markets that we have available. So we really need to get underneath some of those barriers and not let ourselves off the hook by just using these pretty straightforward broadcasts. I don't know anybody that doesn't know that they should eat 5 a day and not eat too much sugary food, but yet people still are doing so. We need to ask ourselves some of those questions, and I think that's about time. I think it's about time, and I think it's about confidence, and those are the things that I think that we really need to address. So that similar thing, just sticking on wider determinants of health, we really know in Tower Hamlets and across London the scale of the housing crisis in terms of a huge wider determinant of health. The cost to the health service of damp and cold homes is huge, and if we were able to make the investment in making those homes more energy efficient and less damp, we would bring down the costs in the health service and but we know the levers to make that happen are diffuse. We're not setting up the welfare state that we did in 1945 now. We're having to completely rethink what the welfare state can and should be doing, because those challenges that they faced in 1945 in terms of free access and just access to medicine, access to advice, those challenges have moved on now so significantly that we need to step up, wake up to those challenges around the wider determinants of health. I wanted to mention one other thing, which is about pollution on that. And again, the levers to address that are diffuse in terms of who has the powers to make the necessary regulatory changes. It's not the same challenge. So that's a big thing that we all need to understand as a community, as politicians, as councils, as central government, and as academics. Really crucial point. The next thing I wanted to talk about was connection versus isolation. So we know from Sir Michael Marmot's work how important connection and being connected to decision making is, and examples of that for me are around training and good work, and how important networks are in order to get into work, and also in order to stay in work and get the training that you might need and to stay in those good jobs. And at the moment, I don't think that we create that space for some of those connections within our communities. We want to be working with grassroots organisations and trade unions and citizen-led groups in order to make sure that some of those great opportunities are connected into people who might otherwise be isolated. Another example of isolation and what we're trying to do about it is thinking about how we link people to the many universal services there are. We are completely committed in Tower Hamlets to keeping community spaces open. So we have a network of idea stores, we have a network of public open spaces, but the challenge for us is making sure that people feel that those are accessible. So we invest in services called, for example, a Linkage Plus services, which is a network of community-based organisations that works with people over 55 to connect them into universal services, but also networked groups. So some of this is around the really linking those communities together so that they are addressing their health challenges together. The next thing to talk about, I think there is a real need to focus on trust and political culture, and the connection between the decision making and what happens on the streets and in the services that people see day to day. And we now have, within the relationship between national and local government, is so complex in terms of the services that are directly funded by national government through national taxation and those that are funded by local government. Different types of money can be spent in different types of ways. One example that I would refer to is development. In Tower Hamlets, we have some of the highest housing numbers delivered in London, and when we talk to our residents, when we're preparing our policies for how those homes will come forward, we hear that people don't feel connected to the developments that are going forward, despite the fact that our local plan is something that has to be determined through our full council and have 2 or 3 rounds of pretty in-depth consultation. And so there is clearly not a connection and therefore a trust in some of the things that local authorities really can do. And I think the reason for that is, I think, the scale of change and the pace of change that people see in communities, and some of the challenges that were faced 70 years ago when the welfare state was being founded are quite different in terms of the visibility of change that people see. So this is longer than 70 years ago, but the Becontree estate took 3, 4, 5 years to see real transformation, and the current processes take an awful lot longer than that to see transformation of places. And there's a tension there, and I'm bringing thoughts rather than necessarily conclusions, but there's a tension there between a deliberative, collaborative approach to development and policy making and demonstrating a change. And I think that's a debate to be had amongst this network, but also with residents and communities. And that's a real challenge, because there's going to be a tension at a grassroots level between what people may or may not want to see on their street corners and the changes that they want to make. The next thing is about joining up health and social care. It is a continuing, it's extraordinary to me that the people who really support vulnerable people in their own homes, unpaid carers and paid carers, are some of the most under-recognised people in our workforce, and for me, not in our workforce. They're hugely valued by the council, by us as leaders and unpaid carers. And one of the best things that I am able to do is spend time with our carer centre, which we invest in as a council, which supports unpaid carers, advocates for them, advises them on their rights, their access to benefits and the services that they're entitled to. And but it is extraordinary, and we need to keep challenging ourselves. Those people that are working so hard, whether they're paid carers or unpaid carers, are some of the lowest paid and lowest recognised within the entire welfare state. And we need to wake up to that and recognise that the people that are doing those work, that work, are not only bringing huge meaning and are an integral part of the lives of vulnerable people, but they are also a really, really important part of the financing of the welfare state, and they're undervalued and under-recognised, and that has to be addressed. There are endless debates that I have to say I struggle to always keep my energy levels up in terms of the integration, which is just such a overused word and really needs to be challenged in terms of what it actually means. I think that services have to be locally based. There's a big NHS reorganisation going on that I won't say I won't bore you with, but I won't talk to you about it today. And lastly, about implementation and delivery, I think we just have to reset the relationship between national and local government. Short-term funding, 500 million here for a press release, 1.6 billion there for a press release, and then it's challenged whether it's new money or old money. We have to stop that, and because unless you invest in and trust in local authorities to actually deliver and to make some of these changes that we need, you'll constantly be wasting, but creating costs with local authorities having to constantly defend or describe services that really we should be able to trust each other to actually get on with and deliver. And I'll let others go now so we can have a conversation. Thanks very much.
Thanks, Rachel. That was excellent, and a lot of really insightful points there. I mean, this is the Mile End Institute, so of course we're fascinated by NHS reform and integration, so don't worry too much. I'm sure lots of people on the call are very interested in those questions. I think also the points you're making there about the relationship between central government and local authorities, I think the crisis has really exposed that that's not working well enough in England. The centralisation, the legacy of that, the under-resourcing of local government have really been illuminated by many aspects of the crisis. So I think those are really powerful points that we might have a chance to come back to in the discussion. I'm going to turn now to Chris Goulden. I think Chris is going to focus particularly on some of the kind of employment and labour market issues which are raised in the report. So Chris, over to you.
Thanks, Patrick, and thanks for having me here today. So yeah, I work for Youth Futures Foundation, which is a work centre focused on youth employment. So I'll be thinking about the report from that perspective. So yeah, the pandemic has highlighted, if I can channel Alan Partridge for a moment, that the welfare safety net is full of holes, but it's also shown that government can act quickly, and that much more funding can be put into welfare than anyone would have dreamed would be possible before the pandemic. So the report covers a huge amount of ground, but is definitely admirably concise and well targeted, and it puts forward those 5 R's by way of recommendations that Mary was speaking about. I found that really useful framing, but I did have a few unanswered questions about those. So how does government join up better, and how many thousands of research reports have posed that question with still no real answer? How can apprenticeships be better targeted and brought back for young people? We've seen growth in the numbers of older workers who are doing apprenticeships, which is great, but if that's at the expense of younger workers, I don't think that's something we should be celebrating. How can public attitudes to benefits be reframed? And my former employer, Joseph Rowntree Foundation, did some really great work looking at the impacts you can have by reframing how we speak about poverty and benefits. And I think there's some really valuable insights there that can be brought to bear on the findings of the report. And what's the alternative to market or doctrine, as the report puts it? And the report claims to be an attempt to get out of the academic bubble, an echo chamber to affect policy change at scale. But I'd be interested in how the authors feel, they've done on this. Looking at the list of participants, I think only 3 were non-academic institutions, and that was IPPR, Joseph Rowntree and Resolution Foundation, who are sort of broadly within the sort of centre-left of that think tank space. I hope that's not offensive, Henry. And I used to work for JRF, so I'm able to say that about them. But those 4 areas of labour market, poverty, social care and mental health, I think are really great picks in terms of the priorities. If there was a 5th, maybe housing should have had its own chapter. That is so important, as you point out. But there were just sort of three questions where I had a slightly different view on some of the sort of underlying trends that you picked out. So on poverty, technically it's slightly lower now than it was 10 years ago. When you look at the overall rate, it's broadly stagnant, and I think you do say that. But I think it's interesting to consider what that is in the longer term. So if we go back to the mid-90s, poverty now is lower than in 14 of those 26 years, going back to 1994, 95. So it's not just that there's been a sort of continuous trend even over the last 10 years of growth in poverty, but looking at children and child poverty in particular, as you do, that definitely seems to have reached a turning point for the worse in the last few years. So thinking about the different groups who are experiencing poverty, and pensioners too, I think is really important to consider. On low pay, again, 15% of workers now are low paid when you look at hourly rates, and that's been a massive drop over the last few years, largely as a result of national minimum wage policy. But when you look at low pay on a weekly basis, there's hardly been any change at all. So that shows the combination of the policy around the national minimum wage, which has largely been pretty successful in terms of bringing the UK up to around the standard for a lot of other countries in terms of that level. But the other features of our labour market referred to in the report kind of undermine that in terms of the numbers of people who are stuck in low pay, but also the nature of the labour market, the insecurity and the part-time nature of a lot of the work. So on the specific labour market recommendations, I'd say a big yes to more resource into training and support for job seekers, and again, especially for young people, where we're seeing a growth in long-term unemployment that's really worrying. So now we've got 250,000 young people who've been unemployed for over 6 months. And as the kind of water starts to recede in terms of furlough and the support that's been put in place, there's a risk that there's a group of young people kind of left behind who are scarred by that experience and aren't given the opportunities to get back into good quality work. I'd say a big yes as well to redesigning conditionality, so that actually focuses on what helps people to get jobs. There's too much in the conditionality regime that is just doing the same thing again week after week, applying for a number of random jobs, expanding your job search area, when this isn't actually working to get people into work. And job coaches must know that, but they're almost compelled to do the same thing week in, week out, whether or not that's working for the individual claimant. I'm a bit skeptical that universal benefits would mean stereotypes about benefit claimants can be dispersed. So people have ways of compartmentalizing their experiences. So if you think about, when child benefit was truly universal, did that really affect people's attitudes towards other claimants on means-tested child support? I think there's some nuances there that need understanding a bit better. But I'd also say a big yes to the meanness of levels of benefits in universal credit and job seekers allowance. £70 is just way below any standard anyone could come up with for what's decent, or even a sort of minimum standard of living at all. And the uplift was clearly motivated by a perception of a different kind of claimant coming onto UC as a result of the pandemic. hence leaving job seekers allowance and ESA at the old rates and only lifting up the universal credit standard allowance. But people lose their jobs all the time, not just in a pandemic. So the above is not really based on any kind of fact, just perceptions and stereotypes about what the pandemic was doing to the jobs market. So overall, I really welcome a lot of the recommendations here, and I'd like to see more about the ways that the labour market and the benefit system can help specific groups. And young people on low incomes who are living independently are a really good example of where there are kind of massive gaps in the welfare net. They're really falling between kind of DFE and DWP in terms of who's responsible for them. So what we think would really help would be an opportunity guarantee of a job or training for young people for every person across Britain. So we've seen that now for Wales and for Scotland. So seeing that for England too is something that we think would really make a big difference for them. Thank you.
Thanks so much, Chris. And I think some really useful challenges there to the report for Paul and Mary to think about, and also some very practical proposals, not least your idea at the end there about that opportunity guarantee. Let's move on then to Henry Parks from IPPR, who's our final panelist. Henry, looking forward to hearing your response to the report and what you've heard so far.
Great, thank you, Patrick, and thank you for having me on the panel. So yes, the report, it's absolutely right, I think, as the report suggests, that we need to have a post-COVID vision of the welfare state as a whole. And IPPR has a programme of work, our Future Welfare State programme, that takes that approach and says that things should be joined up. So it's good to see that echoed here. I'm mostly going to come at this having recently worked on a paper specifically on in-work poverty. But in the spirit of this report, I'd like to talk about kind of three cross-cutting aspects of that. So firstly, just on kind of sort of pure levels of generosity in the benefit system, which Chris has already sort of touched on, but I'd like to elaborate slightly. Firstly, in terms of pandemic setup, I think it's fair to say that pandemic has made many people feel quite differently about the benefit system. Specifically, I think over the kind of last decade or so, there's been, talk about political culture, it's been a very successful campaign that sought to create a sort of us and them mentality. And I'd say a lot of people prior to the pandemic, they hadn't really sort of cared about the benefit system very much, hadn't really thought about it. They probably convinced themselves that they would sort of never need it. And it was no interest of them, therefore, what happened about it for them or the people that they cared about. And I think the pandemic, to some extent, has kind of smashed that perception. Lots of people have been relying on the state through the benefit system and also through furlough, and it's made people think about and pay attention to that question of adequacy. And I think that's really interesting and an opportunity. I think it's time for us to have a proper conversation about adequacy. And I think we need to recognise that the benefit levels that we have today, £20 uplift or not, they're really quite arbitrarily set. They don't relate to the cost of living. They have no grounding in what, as a society, we would kind of expect someone to reasonably live on when they fall on hard times, fall out of the labour market, or indeed if they're not able to work for other wider reasons. And we know that even with that system, it's been subject to kind of very sustained erosion over many years. And so I think as a society, we need to kind of agree what standard of living we can actually expect people to live on as a minimum. Basically, no matter what happens, there's a level of payment that should be there. And we should ask ourselves whether we are hitting that mark. And I am talking about kind of, things that we can probably all universally agree on, regardless of kind of political persuasion. You would like to think about affording to eat, affording to eat well, being afford to heat your home and to live with dignity, is the kind of line that we're looking for, and making sure that our system delivers that. Secondly, I just want to talk about, I'm happy to see references to housing in the report. I think conversations about poverty need to become actually conversations that are much more about housing. So really pleased to see that kind of highlighted. So in our recent IPPR report, we've sort of documented the growth in the private rented sector in recent years. It's grown much faster for poor working households than on average, given how expensive the private rented sector has got due to other wider sort of forces going on in the background. That's meant that some of the poorest groups have faced the largest increases in housing costs, who are clearly a group who are least able to bear that. So yeah, we must get a grip on housing costs to tackle poverty, and we need to make sure that these conversations are being joined up. There's not a, I'm thinking about IPPR, we have a housing team, we have a welfare team. We need to be talking to each other much more often, and I would say that's true in government and in the wider policy community as well. And then finally, I just want to talk about childcare. And the role of childcare, actually, which is alluded to in this report, but not in the poverty chapter, but as you say, it all joins up. So I want to highlight that role of childcare and enabling people to increase their hours as a way of escaping in-work poverty. There's a point around state-provided support for childcare. It's grown in recent years. The offer has improved a lot, and that's really positive. But what we've left with is it's very complicated to get your head around the options. I think in particular, childcare provision and support in universal credit, it's very complicated, quite badly designed. We sort of expect that people on low incomes will be able to incur large upfront costs for childcare, and then it's all fine because they'll get it back in universal credit in 2 or 3 months' time, is not helpful at all. So it's kind of good in principle, but the delivery is not really working. And then also, it's withdrawn at very sharp rates as your earnings increase as part of your UC award. And then also just around the question of availability of childcare. So let's suppose we managed to fix it and everyone had enough money to pay for it. There would still be questions around is there availability when you need it, where you need it? There's large geographic disparities there. And relating to sort of market orthodoxy, I think childcare is definitely one of those cases where the free market is not particularly delivering for people, and we would like to see a move towards kind of greater state provision, state involvement, directly supplying it, kind of like schools and etc. And yeah, we think actually that this could have a big impact on poverty reduction, and also it would help us hit other kind of really important societal goals like gender equality. So yeah, I'll stop there.
Well, thank you so much, Henry. And I think you make some really powerful points there. I think particularly on childcare, actually, where I would certainly say, at least from my perspective, that having achieved reasonable prominence on the public policy agenda, childcare in early years really seemed to have slipped away. And actually, the failure to focus on the situation in the early years sector in the light of the pandemic is, I think, one of the biggest kind of potential public policy disasters coming out of COVID-19. But, a lot more to be said there. All right, well, look, Paul and Mary, you've got a lot of ideas and thoughts obviously being put to you there, so you might want to come back on some of those. We've also had some great questions in the chat, which it would also be good to hear Paul and Mary's thoughts on. One question is about the national minimum wage from David Coates. Has it reached the limits of its capacity as an instrument to eliminate low pay? Are new initiatives needed? A revived fair wages resolution to ensure decent pay and conditions across the public service supply chain? And there's some other points that David makes there about old wages councils and the role that they played in terms of fixing labour standards and pay rates. And then there's another question about the kind of priorities in all of this. Obviously you make a lot of recommendations in this report. There's a lot of policy ideas, but what do you think are the priorities given that resources are limited and there's only so much that can be done? So I want to give each of you a chance to respond. Maybe Paul will come to you first and then I'll go to Mary. So Paul, over to you.
Thanks so much. Yeah, just working backwards there in terms of which policies to prioritise, that's a tricky one, right? But of course you have to make some reasonable choices and decisions. I personally think ending low pay and insecure employment would make a dramatic difference to a huge number of lives, and could end potentially or could reduce poverty, could also improve health and well-being, and could have a very significant difference there. I would choose that. And if there was a second one, I would reform the housing market. I think that is absolutely crucial. One of the most fascinating things about the whole benefit system really is that if you are claiming universal credit, you're unlikely to be able to pay your full rent and have much left over at the end of the month. I looked into this on my own street when we were doing the report, and I was utterly shocked. That individuals on my street would have insufficient income from universal credit to cover rent, and that's something that needs to change drastically, and should change. With regard to the national living wage, I'm still broadly in favour of that approach. I think I do feel that the national minimum wage has made a big difference, and I feel that a national living wage as a piece of legislation could also be a first step in reforming that particular area. There are, of course, other solutions on the table, such as those mentioned by David Coates, but I think initially it's about first steps, and a national living wage would be a sort of great way forward. So yeah, thank you.
Thank you very much, Paul. Mary, what are your reactions to what you've heard, both from the panelists and also from the questions that we heard there from participants in the seminar?
Thank you. Well, my first reaction is to thank all of the panelists, but also those who are putting comments in the chat and asking questions. And there's so much in what everybody said, I think, that we can't respond in detail. But I suppose what I'm really preoccupied, I think Chris mentioned it, but also it was underlying some of the other comments, is how we get from where we are to where we need to be. And that's a question about particular policies, I think. But for us, we think, and here we come back to Michael Marmot's point about a change of political culture and a change of public culture and what the public knows about the welfare state. And it's good, as Henry said, that actually they expect, universal credit numbers, I think, doubled over the course of the pandemic. So people were encountering the system much larger numbers of people were encountering the system than heretofore, although maybe they were encountering a different system to the usual universal credit system in that sense, in that some of the conditions were eased during the pandemic. But the point is, I think that what we're saying is we have to change the conversation, really. And absolutely, Rachel's right, and other people are right, that different policies or different problems need different approaches. But there are underlying things that are drawing all the problems together, and that are, I think, creating this kind of stasis and this really limiting our horizons of what's possible. So universalism, why aren't we talking about it, really? Why are we censoring ourselves or allowing ourselves, whether it's academics or people, receiving the benefit system or whatever, why are we allowing ourselves to be censored like that? And universalism, we think, or we suggest, is not just about changing public opinion. It actually is a much better system. It works much better than what we know about the high conditionality system that we've ended up with in this country. And other ideas that we should be open to are care as a national value, that we care for each other, we care about each other, we care about our environment much more than we do. What about solidarity? Why is solidarity a word we don't allow ourselves to talk about? So I think, I won't go on, but our point, I think, is open up these debates. Don't allow ourselves to be in this narrow vision whereby we can't afford to spend any more money. We have to rely on a labour market where we think a huge labour market initiative is that we regulate the lowest levels of pay. Why is that the best we can do on labour market or other forms of regulation? So that would be my first point. And with regard to what area, I suppose, because Paul has chosen two, I can choose another two. But I think universal credit and the way it treats people and the levels of living or unliving that people are exposed to, that I would have to see that as the first thing. And I think we've ended up with this system, which wasn't the way it was originally designed to be. And it doesn't really solve the problems it was meant to solve. And more than that, as we said in the slides, it actually creates more problems, and it creates hardship and disinvestment in people and areas that makes it impossible to build back better, I think.
Thank you very much, Mary. I want to just give Rachel an opportunity to reflect on some of the other points that were made from her perspective in Tower Hamlets. So Rachel, do come back on those points, particularly about the costs of not being universal in social policy.
Thanks, Patrick. I really wanted to emphasise how much money I think is spent responding to a targeted approach. So I think about some of what we do as a council to remind people about their rights in terms of welfare benefits. We have an income maximisation team that writes out to people to remind them about the benefits that they're entitled to. And I think the fact that the social security system was established in a completely different world of work means that we need to transform the way we think about access to benefits and really establish a rights-based approach, because the costs of not doing so are also really quite significant. I think the other things that's really important for the policy community to recognise, and I think we all need to step up on this, is we don't recognise the dynamism of work and the dynamism of communities either. And I think it's far too easy to sit in a place where you think that applying for universal credit is something that you'll do once and you'll be on it for a long time, or same with housing benefit. The amount of pressure that is on local authorities in terms of the administration and management, but also on communities and individuals having to understand their benefits and these kinds of applications creates a burden on itself, and I think is connected to an approach like anxiety and mental health responses in terms of the complexity of our welfare state as well. And I think if we can alleviate some of that structured around a rights-based approach, we really could step up some of this transformation.
Thanks, Rachel. Really useful points there. Before we finish, which we'll have to do in a couple of minutes, I just wanted to invite Sir Michael to come back. In your remarks, Michael, you kind of signalled that there are some very depressing trends out there at the moment. And of course, you referred to the example of the debate around education and the underperformance of white working class pupils. I wondered, though, before we finish, are there any causes for optimism in all of this? Do you yourself, having looked at these reforms over a fairly long period, do you see prospects for serious reform by which we can start to grip some of these issues around social policy and health inequality?
I am optimistic, and I don't know if it's just because I had a secure childhood with caring parents, but I am optimistic. I used to go around the world saying I was an evidence-based optimist, and a Brazilian colleague said, Michael, you're using the English language incorrectly. I was grateful for this Portuguese speaker. He said, you're not optimistic, you're hopeful. And he pointed out the distinction that an optimist thinks things will get better. You're hopeful that they'll get better. So I'm hopeful rather than optimistic. And the reason I'm hopeful is the degree, and I'm looking at Rachel, the degree to which local government has responded positively to these messages. We've been working with Coventry. Coventry declared itself a marmot city. As I mentioned, next week we're producing a report. Andy Burnham said if Coventry can be a marmot city, Greater Manchester can be a marmot city region. So we're producing a report of our work with GM. Cheshire and Merseyside approached us. Cumbria and Lancashire, north of Tyne, combined authority. So local and regional government all around the country has been approaching us saying, how can we work with you to create fairer, better communities to improve health and achieve greater health equity? So the more time I spend looking at national government, the less hopeful I feel. The more time I spend with local and city government, the more hopeful I feel. Now, it's not going to be like that forever. We're not going to be governed by pygmies forever. Well, sorry, that's very offensive to pygmies. That will change, but I am hopeful because of and I think there's something real in it. And again, Rachel, this is what she lives and breathes. I think people in local government, whether they're Conservative or Lib Dem or Labour, they have a much better understanding of the conditions in which people are born, grow, live, work and age, what I call the social determinants of health, because they live it every day. Their constituents live it every day. And so I find it easier to talk to people of different political persuasions at the local level than I do at the national level. So yeah, I'm really hopeful. Now, at some point, that will feed in, I hope, to changes at national level.
Well, thank you so much, Michael, for giving us a note of optimism on which to end the discussion. I think it's always good to end on a note of hope rather than, as it were, a note of pessimism about the direction of policy in some of these areas. But we really will have to leave it there. I just want to thank, obviously, our panel. So thank you so much to Sir Michael, to Rachel, to Chris and to Henry, and obviously thank you so much to Paul and Mary for a fascinating presentation on their report. Sophia has posted a link to the report in the chat, so if you haven't downloaded and read it yet, then please do so. At the Mile End Institute, we very much hope to keep the conversation going around the debate about the future of the welfare state, so do sign up to our newsletter. Thank you for coming along. Thanks for the really interesting comments and questions in the chat, and we look forward to seeing you again soon. Have a good afternoon. Thank you.
Bye.